Hi, I'm Dr. Julie Steinauer. Let's talk about, does your infant have an eye turn, and what does that mean and what can be done about it? So if you look at your child and you're like, wait a minute, I did his eye or her eye just turn? There are a couple different types of eye turns that you need to be aware of. So if these are our eyes, an eye turn in is a specific kind. They'll look cross-eyed. It's called esotropia. If the eye turn happens to be out, it's called exotropia, and they'll look spacey-eyed like they're not paying attention. If the eye turn is up and down, you can notice a hypertropia for up, or even a hypotropia, which is a little bit less common to see. It generally indicates maybe some brain injury, or maybe there might be some other conditions going on to cause the hypertropia. Usually hyper is a lot more common. Now there is another type called diagonal or cyclotropia. For the most part, most people are not going to be able to notice that and recognize what it really truly is. But most of the time you'll be able to see if the eye turn is in, or if there's one eye that's just floating up and you're wondering what on earth is going on, why is their eye floating up? Okay, now let's say they do have strabismus. What do you do about it? Is there something that you should be doing, and when should you actually be intervening? Well, the thing is that before the age of 6 months, at 6 months the brain is kind of hardwiring their depth perception or their ability to see things in 3D. So if you catch it before then, you definitely want to start intervening and do something about it. I did with my son. I noticed that he was having this problem with his eyes being out, and it was around about 4 months of age that we put him in some specialized glasses and then began working on him with Syntonics, or the photo light therapy goggles that we talk about a lot. So if you notice this with your infant, definitely have them checked out by an eye specialist. Make sure, not just your pediatrician, that's not good enough in these situations because they are not a specialist of the eyes. They are a general body doctor, and they are not qualified to be able to really give the correct information about the eye turn to you. You want to have your eye specialist take a look at their eyes just to make sure that everything is healthy and okay. Once you determine that that is the case, then you're looking at, what do I want to do? Sometimes the option would be to think about, well, if it's still there after a few months, the doctor might recommend having surgery on the eye. Or are there alternative options? And the answer to that is yes, there are alternative options. So this is something that we work with a lot. I even said I did this with my own son. But what we do is look at, do we potentially need to put them in specialized glasses to help train their brain how to use their two eyes together? We also use the Photosyntonics or Syntonics light therapy goggles to electrically train their brain how to use their two eyes together. Now we have a specific method for this, obviously, because if they're infants, their heads are small and they're little and they probably won't leave glasses on. And so we have a method of doing that with what we call like a surrogate method. So this is where the adult actually wears the goggles, and it helps the infant to be able to have the change electrically in the brain that connects to the muscles and tells the muscles how to line up properly. So there's a cool method that we use for infants to correct this. So you can do it at any age. And then as they are developing, we're going to be suggesting certain activities that you can work on to develop their brain better. And it's amazing. So we can see changes before they hit that 6-month time frame when their depth perception should kind of be getting hardwired in. Now, if you're like, oh my gosh, that didn't happen, and we're at 8 months, or we're at 10 months, or we're at a year, is it too late? No, it's not too late, because we actually help people gain the use of their two eyes. We correct the strabismus with them at any age. And so depending upon the severity and what actually is going on, all cases obviously are different, but in most cases we can train the brain how to align and use the two eyes together and develop normal depth perception, even if it's an adult that we're talking about. So certainly this works with children, and it's a very safe and effective method, and it's not as invasive as maybe some other methods out there. This is really training the brain how to be the control center for the muscle, instead of just doing something to the muscle, like performing surgery on it. So we're super successful with these things. It's a combination of light therapy and then some vision therapies, kind of like some gross motor or some body movement activities specific towards their type of strabismus. And we see amazing results. We might even see that by the time 6 months rolls around, if we've worked with them, say starting around 4 months, they might be completely and perfectly aligned with their eyes and not need to do anything ever again, with totally normal depth perception. Depending on when we start working with them, let's say they're a little bit older and they've already kind of developed some depth perception that was not accurate, or maybe they didn't develop it because the eyes weren't lining up at the time. Even if we feel like, oh gosh, we missed our window of opportunity, that's never going to be the case, because again, we can work with someone who's older, and as they get a little bit more mature, there's more activities that we can work on. So really, vision therapy and Syntonics can start at a super young age, like a couple of months, and it can span a whole lifetime. There's not a time frame in which we cannot work to correct this with your infant or with an adult even. So if this is something you're thinking, wow, what, I've noticed this with my child, I need to talk to someone about this. Certainly you can give us a call if you're local. Our phone number is 618-288-1489. If you're not local to us, then what we want you to do is we want you to go to our website at visionforlifeworks.com, and there is a form that you can fill out. There's two options actually. You can go to the questionnaire and fill that out, and then that will come over to our clinic and we'll respond via email to you about how we might be able to help you with your child. Now, if you want to just go past that, like don't stop, don't go home, you want to go straight towards getting a consultation with me, then there's actually a button on our website that's schedule a consultation. And so if you click that button, you can, a schedule is going to kind of pop up after you've paid for the consultation, and you'll be able to choose a date and time to meet with me on video face to face and discuss what's going on with your infant. I will want to see your infant during that time so that I can find out what's going on with them, and I can assess their vision just by looking at them. We'll also talk to you about how we want to get notes from another doctor. If they've been seen by someone, we'll want to have that information to accurately assess what's going on with them. But you can, again, if you're not local and you happen to be overseas, you can connect with us either through scheduling a consultation or by filling out that questionnaire. It's a quality of life questionnaire on our website at visionforlifeworks.com. Now, if you like this video, go ahead and like it. And then if you like the content that we put out, we would love it if you subscribe to our channel. You can also pass this video along if you know someone who happens to have an eye turn and you feel like it could be helpful for them. Thank you.